Hand pain relief home remedies. Carpal tunnel syndrome is a common nerve condition that causes numbness, tingling, and sometimes pain in the fingers and hand. Doctors do not recommend replacing conventional treatment with alternative measures. Carpal tunnel syndrome (CTS) ranges from mild to severe. Appropriate treatment can often restore function in the hand and wrist and relieve symptoms. The carpal tunnel is a narrow passageway that runs from the wrist to the hand on the palm side of the wrist. Bones, ligaments, and tendons make up its structure. A nerve called the median nerve passes through the tunnel. The median nerve runs from a network of nerves that start near the neck and shoulder and run down to the hand. The median nerve provides sensation to the thumb, index finger, middle finger, and the thumb side of the ring finger. CTS causes tingling, numbness, thumb weakness, and dull aching in the hand or arm. This occurs due to pinching and compression on the median nerve. In the United States, the condition occurs in between 4 and 10 million people. Severe CTS may require surgery. However, in this article, we look at the possible options for supporting and easing the symptoms of carpal tunnel syndrome at home. 10 lifestyle measures. The following lifestyle and home remedies may provide some relief for mild to moderate CTS symptoms, but little clinical evidence supports using them in place of conventional treatments. Always seek advice from a doctor. Some medical professionals suggest avoiding repetitive hand and wrist movements, where possible paying attention to the hands and wrists and stopping activities on feeling pain, discomfort, or numbness, taking frequent breaks if activities that involve repetitive hand movements are unavoidable, trying to keep the wrist in a neutral position without extending the wrist too far up or flexing it too far down, using the largest joints possible when lifting, such as the shoulder, to avoid extra stress on the wrists, hands, and fingers, not holding objects in the same way for too long, avoiding power tools that vibrate, such as jackhammers and floor sanders, adapting the workplace to keep a neutral wrist position, relaxing the grip or level of force during activities that involve the hands, such as writing, trying not to sleep on the hands or with the wrists in bent positions. Some evidence suggests that regular physical activity and exercises, especially involving the hands, may help protect against mild CTS. However, CTS does not usually resolve without management, and it can get worse without medical intervention. Seeing a doctor on experiencing persistent numbness or weakness in the hand is essential. 10 home remedies. The following home remedies may help relieve CTS. Resting the affected hand and wrist for at least 2 weeks using anti-vibration products with vibrating tools, wearing a wrist splint or brace to rest the median nerve, doing gentle hand, finger, and wrist stretching exercises, massaging the wrists, palms, and backs of the hands, wearing work gloves to protect the hands and wrists, applying heat to the wrist to help reduce pain, wearing an ice pack, which may also help to lessen swelling, adding extra material to tool and utensil handles for a more comfortable grip, taking over-the-counter, OTC, pain medication, such as ibuprofen or naproxen. People who try OTC medications should be aware that studies have found that they do not provide full relief for people with CTS symptoms. They may also increase the risk of gut problems and bleeding. Alternative therapies. The Mayo Clinic suggests that some alternative treatments may help improve the symptoms of CTS. Some studies have also recommended that the following methods can provide short-term relief. Yoga, stretching and strengthening exercises may reduce pain and improve grip. Hand therapy techniques used in physical and occupational therapy may relieve symptoms. Ultrasound therapy raises the temperature of the affected area, potentially reducing pain and promoting recovery. Applying topical anti-inflammatory medications as well as ultrasound may also be helpful. Laser therapy might improve symptoms according to limited evidence. Chiropractic treatment may reduce symptoms in some people. Acupuncture may also benefit some people and improve symptoms. The American Academy of Orthopedic Surgeons recommends additional research. People should always check with their doctors before using any complementary or alternative treatment. Medical professionals do not recommend replacing conventional treatments with unproven therapies.